morning all. Today we are going to discuss about lacrimal apparatus. The lacrimal apparatus concerned with secretion and drainage of lacrimal fluid. The lacrimal fluid, which is secreted by the lacrimal gland into the conjunctival sac, which lubricates in front of the eyes and deep surface of the eyelid. Periodic blinking, which helps to spread the fluid over the eye. Most of the fluid evaporates, rest is drained into the lacrimal canaliculi. The excessive production of the lacrimal fluid overflows as tear. Parts of lacrimal apparatus are the lacrimal gland and its ducts, conjunctival sac, lacrimal puncta and lacrimal canaliculi, lacrimal sac, nasolacrimal duct. First we are going to learn about lacrimal gland. The lacrimal gland, which is situated in the lacrimal fossa on the anterolateral part of the roof of bony orbit and partially on the upper eyelid. Sometimes we can see small accessory lacrimal glands. It is called as Krause. The lacrimal gland is J-shaped and it has large orbital part and small palpebral part. Both palpebral and orbital parts are separated or indented by levator palpebrae superioris muscle. And also we can see about 8 to 12 number of duct of lacrimal gland which is pierces the conjunctiva of the upper eyelid and open into the conjunctival sac near the superior fornix. We have superior and inferior fornices are there, and the fornices are formed by the joining of or the junction of palpebral and the bulbar part of conjunctiva. The part of the conjunctiva which lines the inner surface of eyelid, it is called as the palpebral conjunctiva, and which lines the eyeball, which is called as the bulbar conjunctiva, where the bulbar and the palpebral conjunctiva are joints or meets. That region is called as the fornices, and the space between bulbar and palpebral conjunctiva is called as the conjunctival sac. The palpebral conjunctiva, which is thick, opaque and highly vascular and which contain the tarsal plate. But the bulbar conjunctiva, which is covers the sclera, and the bulbar conjunctiva is thin, transparent and loosely attached over the eyeball. The bulbar conjunctiva over the cornea, which represents the anterior epithelium of cornea. The stratified squamous non-keratinized epithelium which lines over the cornea. Next we are going to learn about the lacrimal puncta and canaliculi. Each lacrimal canaliculus begins at the lacrimal punctum. The lacrimal punctum, which is present at the medial corners of the upper and lower eyelid. While we are observing on the medial corner of the eyelids, we can see one or two openings on upper and lower eyelids. They are called as the lacrimal punctum. The lacrimal canaliculi, which is measures about 10 mm long, but it is again divided into two parts, the vertical and horizontal part. The vertical part, which is measures about 2 mm, and the horizontal part, which is measures about 8 mm. At the junction of vertical and horizontal part of the canaliculi produce a dilatation which is called as superior and inferior ampulla. Both canaliculi opens close to each other in the lateral wall of the lacrimal sac behind the medial palpebral ligament. Next, the lacrimal sac. The lacrimal sac, it is a membranous sac which is measures about 12 millimeter long and 5 millimeter wide, which is divided into fundus and body of lacrimal sac. The fundus, which is measures about 3 to 5 millimeter, and the body of the lacrimal sac, which is measures about 10 millimeter long. And the lacrimal sac, which is situated in the lacrimal groove behind the medial palpebral ligament. The lacrimal sac is related anteriorly to the medial palpebral ligament and the orbicularis oculi muscle. Medially, the lacrimal groove, which is separated from the nose. Laterally, it is related to the lacrimal fossa and lacrimal part of the orbicularis oculi muscle. Next, the nasolacrimal duct. It is a membranous passage and which measures about 18 millimeter long. It begins at the lower end of the lacrimal sac and it runs downwards, backwards and laterally and opens into the inferior meatus of nose. It is exactly open at the junction of anterior 1/3 and posterior 2/3 portion of the inferior meatus, and the opening of the duct, which is guarded by a valve, it is called as Hasner's valve. Next, the secretomotor pathway of lacrimal gland, which is divided into two. They are the preganglionic and postganglionic fibers. The preganglionic fibers: lacrimatory nucleus, facial nerve, geniculate ganglion, greater petrosal nerve, Vidian's nerve, pterygopalatine ganglion. The postganglionic fibers includes the maxillary nerve, zygomatic nerve, zygomaticotemporal nerve, and which is connecting with the lacrimal nerve of ophthalmic division of trigeminal and which is relating to the lacrimal gland. The preganglionic fibers, which starts from the lacrimatory nucleus, which is situated in the pons. Then the fibers passing to the facial nerve and which reaches to the geniculate ganglion of facial nerve and which gives a greater petrosal nerve. The greater petrosal nerve joins with the deep petrosal nerve and which is passing through the pterygoid canal as nerve of pterygoid canal or Vidian's nerve. Then the nerve which relates to pterygopalatine ganglion. Then the postganglionic fibers arises from the pterygopalatine ganglion and the fibers passing through the maxillary nerve and reaches to the zygomatic nerve. Then the zygomatic nerve which gives a branch, it is called a zygomaticotemporal nerve, and the nerve which joins with the lacrimal division of ophthalmic nerve and relates to the lacrimal gland. Next we are going to learn about some clinical aspect due to the trauma or congenital anomalies, aging or inflammation of lacrimal gland, prolapse or displacement of lacrimal gland. Next, dacryocystitis. It is causes due to the inflammation occurs on lacrimal sac and also that causes the blockage of nasolacrimal duct. And this is about lacrimal gland. Thank you.